Students, we are going to study pericardial disease. Let's know some introduction about pericardium. You can see the image. In the image, we can see the different layer of the heart: endocardium, myocardium, and the third one is a pericardium. Okay, pericardium is also called pericardial sac, which is a double-walled sac that encloses the heart. So there is a double wall which composed of pericardium. The two layers of the pericardium is fibrous layer and the second is a serous layer. The fibrous pericardium, which you can see from the outside, the last superficially which is present. So superficial layer of the pericardium is called fibrous pericardium, which is made up of dense, loose connective tissue. And the function of this fibrous pericardium is it protects the heart and also it anchored the heart to the surrounding walls. Now, if you talk about the serous layer, the serous pericardium is the inner layer of the pericardium and further divided into two more layers, which is a visceral and parietal layers. So, visceral pericardium, we can see the parietal pericardium, and the space between the visceral and parietal membrane is also called pericardial cavity. So, you can see this is the pericardial cavity between the parietal and visceral pericardium. So within the pericardial cavity, there is a fluid, and the fluid is called pericardial fluid. Okay, so this is the normal structure of the heart. We have seen the microscopic structure of the heart muscles. From superficial to the inner. Superficially, it's a fibrous layer, and the most inner part is the endocardium. Okay, endocardium, then followed by myocardium, then we have a pericardium, and pericardium we have a two-layer, it's a double sac we say. So fibrous layer, serous layer, and serous layer is of two types: it's a visceral layer and parietal layers. Okay, so between the visceral layer, and this is a visceral layer, and this one is a parietal layer. Between that, there is a cavity, which is a space, and this space is usually filled by a fluid known as a pericardial fluid. The fluid usually, what is the function of this fluid? It lubricates the heart and allows beating with a little friction. So, and there is no friction at all because of the fluid, and there is a it acts as a lubricant also. Okay, so this is what the normal the structure we have seen, and where we have seen the pericardium, the layer. Okay, the sac, double sac like structure, where we have noted the which one is the fibrous layer, which one is the serous layer, right? Mohammed Monaf is willing to join. Okay, so hope you have no any doubt from this slide. You can ask me if you have any doubt. Now moving to the next slide, which is related to the pericardial effusion. So you can understand pericardial effusion once you have the concept of the general structure of the heart pericardium. Okay, you can see in the image, this is the normal heart with the pericardium. Okay, in the pericardium, this is the double sac like structure, two layer at the outer side we can see. So fibrous layer is a superficial layer, followed by there is a serous layer which consists of visceral and parietal, and between the visceral and parietal there is a fluid that we have studied. Now if you talk about the pericardial effusion, what is this? So you can see there is a buildup of fluid. There is a buildup of fluid between the space that the space is what pericardial cavity we call it, and within the pericardial cavity or within the space there is the fluid is built up abnormally, and this buildup of the fluid which is abnormally occurs. So this condition is called as a pericardial effusion. So sometimes also referred to as a fluid around heart, fluid around the heart. So this is condition. Pericardial effusion is also sometimes what we call them as a the fluid accumulation of the fluid around the heart. abnormal buildup of excess fluid between the heart. So you can see between the heart, this is the heart, and between the sac, okay, between the sac and between the heart, there we can see there are sorry. So there is an abnormal buildup of excess fluid between the heart and the sac surrounding the heart. So sac is what we call them as a pericardium. Pericardium is a sac. So between the sac and the heart, there are actually fluid is built up, and that fluid build up condition is called as a pericardial effusion. Mostly not harmful, but sometimes can make the heart work poorly. So here, the accumulation of the fluid may not be the harmful condition. Here, what it can cause is it can compromise the functioning of the heart. The heart work will become decreases. So heart work is what the pumping of the blood. So the heart will not be able to pump properly. Okay, so it may can affect the pumping of the blood. Let's know the comparison between the normal pericardial fluid and the pericardial fluid during pericardial effusion condition. So normally 2 to 3 tablespoons of clear yellow pericardial fluids are between the sacs two layers. So whatever the sacs two layers, this is a double sacs layer we have seen. One is a fibrous layer and another is serous layer. So between the fibrous layer and serous layer, okay. If you talk about the fluid is basically present in the pericardial cavity, and normally what is the volume of the fluid present? It is 2 to 3 tablespoon. Okay, this is the volume of the pericardial fluid normally present, and the color is usually clear yellow. So this is the clear yellow color, we can see it. That fluid helps your heart move easier within the sac. So heart can move within the sac. When the heart actually pump, so the pumping usually occurs because of the relaxation and contraction of the heart muscles. So during contraction relaxation, the heart usually move. It feel like a moving. Okay, so move. So here if there is a fluid, so the fluid helps your heart move easier within the sac. Okay, this is the normally happens. But if there is a pericardial effusion, so here, if you have a pericardial effusion, much more fluid sits there. So here we can see the pericardial effusion condition. The fluid's volume increases. Okay. Normally we have 2 to 3 tablespoon volume, but here small ones may contain 100 ml of fluid. Means if there is a mild cases of pericardial effusion, so minimum 100 ml of fluid can be present in the pericardial cavity. Maximum, we can see the very large ones may have more than 2 liters. So maximum volume of the fluid may be around 2 liter of the fluid can be present within the pericardial cavity. So in pericardial effusion, we can see the accumulation of fluid from 100 ml to 2 liter of the fluid within the pericardial cavity, and this condition is called as a pericardial effusion. What are the causes? How this pericardial effusion occurs? In most cases, inflammation of the sac. The sac, basically the pericardium layer, there is inflammation. Okay, and we call them as a pericarditis. Pericarditis is the inflammation of the pericardium, which leads to the pericardial effusion. As it becomes inflamed, more fluid is produced. So here, when there is inflammation process, okay, so the fluid volume will increases. These are the causes of pericardial effusion. The viral infections caused by cytomegalovirus, Hoxa, key virus, ecovirus, HIV infections, bacterial infections such as tuberculosis caused by mycobacterium tuberculosis, maybe because of cancer also, injury to the sac, or hard from the medical procedure. So when there is a medical procedure like surgery, so in such condition, there may be the injury to the sac, and in response to the injury to the sac, there may be the accumulation of fluid within the pericardium cavity. Heart attack can also accumulate fluids in and can lead to the pericardial effusion. Severe kidney failure, also called uremia. So kidney failure also can arise the pericardial effusion, and autoimmune disease. So when the immunity become abnormal, okay, immune system, there is a dysfunctioning of the immune system where the antibodies are produced against the self antigens. So that is called as autoimmune disease. For example, lupus erythematosus or rheumatoid arthritis, or maybe the other type of autoimmune disease. So here pericardial effusion may can develop. What are the symptoms of pericardial effusion? The main symptoms is chest pain. So chest pain is the hallmark of pericardial effusion. The patient always feel a chest pain. It may get worse. The chest pain, may get worse when you breathe deeply, and better when you lean forward. So, uh, this is the word. The pain usually become worsen when you breathe very deeply. Okay, and when you lean forward also. So the leaning condition at the position of leaning position, or when you breathe deeply, at that situation, we can see the sensation of pain in the chest. Other symptoms are there which indicate the pericardial effusion, like fever can occur because of the inflammation, fatigue, muscle ache, shortness of breath, and nausea, vomiting, diarrhea. So these symptoms are usually found in the viral infection. How can we diagnose that? How can we diagnose pericardial effusion? So we can do the physical examination, which is done by the clinician, a cardiologist. Electrocardiogram test can be done. We can do the chest X-ray. We can do the blood test, and we can also do the pericardial fluid test. Like we can take the pericardial fluid, and we can just put on the slide. We can prepare a smear, and we can examine under the microscope to see if there is a bacterial infection or some abnormal condition of the fluid. Okay. Now let's know about constrictive pericarditis. What is constrictive pericarditis? Constrictive pericarditis is a long-term or chronic inflammation of pericardium. So it's a long-term, or you can say the chronic inflammation of pericardium. Pericardium is there is inflammation of pericardium for the long term. Okay, where we can see in the image also the inflammation of the pericardium takes place. Okay, and if the process is for the longer time, and then this will progress into the development of constrictive pericarditis. Inflammation in pericardium membrane of the heart causes scarring, thickening, and muscle tightening. So this is what changes takes place in the pericardium membrane. There is a scarring also, there is a thickening also, and there is a muscle tightening also. Okay, you can see in the image thickened pericardium. The cardium layer pericardium layer very thickened, and this is what we call them as a pericardial constriction or constrictive pericarditis. Symptoms of chronic constrictive pericarditis are: it's a difficulty in breathing. What we say dyspnea. Dyspnea means abnormal breathing process that develops slowly and get worse. So it develops slowly, and the condition may become very serious. The fatigue is another symptoms. Long-term swelling of the legs and ankles. So the ankles and legs becomes swollen for the longer period of time. Abdomen also becomes swollen. The patient feel weakness And the causes of this constrictive pericarditis are idiopathic. Idiopathic means something which the cause is uh, not known. Okay, it's not known. It can be because of viral infection, maybe because of tuberculosis. So idiopathic. 40% of the constrictive pericarditis are idiopathic, whereas 37% of constrictive pericarditis are because of cardiothoracic surgery. So patient undergoing cardiothoracic surgery usually develops sorry, we were at this slide. So patient undergoing surgery of heart surgery in the thorax region. So 37% of the patient usually develop constrictive pericarditis, and 9% cases are because of radiation therapy. So patients who are taking radiation therapy, so they may get constrictive pericarditis. Now let's know cardiac tamponade. What is cardiac tamponade? Here, this is a serious medical condition. Again, and what happens in this cardiac tamponade? The blood and fluid fill the space between the sac that encases the heart and heart muscles. So what we see that there is a space, we know the space, pericardial cavity we call it, that is space, and in that pericardial cavity we see that there is a fluid normally present, and if that fluid is replaced with the blood or abnormal fluids, okay, when it fill the space which is present in the sac, so this cardiac tamponade may take also occur. Okay, the cardiac tamponade is because of the result of the filling of the space with the blood and the what we say, the fluids. Fluids are normally present, but there may be the large volume of the fluid. Okay, this places extreme pressure on your heart. Because of this excess fluid, okay, excess fluid within the space, so this excess fluid can place extreme pressure on your heart. Okay, if you have experience, if you have I have the similar process, like the filling of the blood and fluids in the space, so this may can place, it may can exert extreme pressure on the heart, and in response to that, the pressure prevents the heart ventricles from expanding fully. So because of this extreme pressure caused by the fluid towards the heart, so the heart ventricles will not be able to expand properly. So what will happen? Your heart is generally unable to function properly. Okay, because of this pressure caused by the fluid towards the heart. Okay, so the heart, basically the ventricles part, what happens, the pressure prevents the heart's ventricle from expanding fully. So the ventricles of the heart will not be able to expand fully, and because of that, the heart is generally unable to function properly. So this is called as a cardiac tamponade. So whatever we have studied in the previous slide, the cardiac perfusion, okay, which we studied that there is an accumulation of the fluid. So cardiac perfusion may can also leads to cardiac tamponade, because the fluid, if it replaces extreme pressure on the heart, so the ventricles may not be able to expand properly, and because of that, the heart will be unable to function properly. And here, this a serious medical condition, we call them as a cardiac tamponade. In the image also, we can see that the ventricles usually expand and constrict during the normal functioning. But when there is a tamponade condition, we can see that the fluid places extreme pressure on the heart, basically on the ventricle side, and the ventricles will not be able to expand properly, right? So cardiac tamponade may occur. These are the symptoms we can see symptoms may be related to respiratory, where there can be the fast breathing or there can be the shortness of the breath. Pain can be felt by the patient, basically in the chest area. In the whole body, we can see the low blood pressure. The patient may feel fainting or lightheadedness. Okay. In the heart, we can see the fast heart rate or we can see the fast palpitation, and there can be the swelling in the extremities also. What is the treatment for this condition? So emergency treatment is required for such condition when there is temporal improvement, and usually underneath or a small tube is used to drain excess fluid. So we can just insert a needle to drain the excess fluid which is accumulated into the space within the sac. Okay. So we have come to the end of the slide. Now, if you have any confusion, you can discuss over here. Yeah, please ask questions if you have. Let's discuss.